The doctors, nurses, clinical officers, pharmaceutical technologists, unions, and all other unions of healthcare workers have commenced with their strike. The reason we are going on this strike is because salaries have not been paid. Salary deductions for 5 months, from October up to February, have not been paid. These are deductions for loans that are checked off or insurance premiums. And so and we also have not been paid our salaries for the month of January and February. So what this has done is that it has listed people in the CRB, the Credit Reference Bureau, and people are unable to access their funds or their accounts or any loans or whatever. So there's many cases of people who have been unable to pay their rent, pay school fees. Children are sitting at home. There are people who can't afford transport to work. There are people who can't even buy, basic necessities like food. And so we've been pushed to go into this strike, and we are not going back to work until such time all the salaries are paid.
The only language that we can understand, that we can listen to, is full payment of salaries and remittance. That is the only solution to this strike. All the other issues that were there on promotion, we have actually set them aside. We just want what belongs to us. And therefore we really hug the governor of Mombasa and His Excellency also the President of the Republic of Kenya. You were here and you launched the UHC program. Now, these things, how will they work? When the county government of Mombasa, after receiving all the reimbursements from last year, they have not been able to clear all the pending bills, and even the county government is not able to run. Why? Because you cannot pay us salaries. Why? We don't know the reasons, because we know you've received all your money up to date, you're collecting local revenues, therefore there is no any excuse that we're going to accommodate.
We have over 900 nurses in Mombasa, of which some are actually in the rural facilities and some in Coast General. But what we are going to do for this strike, if it's not going to end soon, or if it's not going to give us the salaries, there are mechanisms we are going to make that we paralyze everything so that the message can go home, and we put a final nail such that we don't strike again, but we just get our salaries always before 5th of every month.
Tumeishi kama beggars, tunaomba. Imagine wewe, you are a qualified health worker, lakini maisha ambayo tunaishi is better than a street children. Akona pesa, yani the way tunaishi is yani it's better to be a beggar than to be a health professional ama a worker working in Mombasa County. Hiyo ndo shida ambayo tuko nayo. Tuna watoto ambao ni wanafunzi. Inasikitika sana utaona mtoto wewe waitwa daktari, lakini mtoto wako ako mtaani anacheza, amefukuzwa na school fees, na mama anauza viazi pale, mtoto wake anaenda shule, hajafukuzwa na school fees. Hayo ni masikitiko makubwa sana. Tunalia sisi kama kina mama, tunanyanyasika paka majumbani, hatuna raha, hatuna amani. Kisa ni mshahara.